most of the information. Just wanted to mention a couple of housekeeping things. We've assembled a very good group of informed people to address you here today, including the chairman of our Board of Supervisors, Kurt Hagman, Supervisor Don Rao, who represents this district, Congressman Paul Cook, the mayor of Yucaipa, David Avila, and our Director of Public Health, Trudy Raimundo. There are many other people here to answer your questions. Sheriff McMahon found time to be with you here today to answer any questions you have and give a few words. As you know, the Sheriff's Department is the contract police department for the city of Yucaipa, so it's really fortunate that the sheriff is here. Okay, I think our interpreter is here. Okay, that's great, because this part isn't supposed to be broadcast. Anyways, we're going to do our best to maintain social distancing, hence the various microphones. We're happy to see you guys trying to do that the best that you can. We'll get started right now. I don't think there's anything else to cover. At this point, I'm going to introduce our first speaker, Kurt Hagman, the chairman of the San Bernardino County Board of Supervisors.
She's going to move next to wherever somebody's, like if they speak over there, she's move over there.
Right. If you can, when someone's at that podium, you can move in front of the other one, and then.
Or just so this person talks, you move over so we can get you in one shot.
Okay.
Great. Thank you.
We had a little brief to figure out which microphones we're supposed to use as we come up. First of all, thank you all for coming and attending. San Bernardino County, like every other county in the state of California, and frankly around the world, we're having our battle with COVID-19 as well. Our residents are doing a good job battling and watching the social distance. We're going to lose some of these battles, and today we have an incident we get to share with you what's going on here. It's important to know that all the levels of government, between federal, state, county, and locals, are working together, trying to keep our residents safe, trying to keep them informed, and do what we can to identify, isolate, and treat those with COVID-19 viruses. Last Friday, we had our first drive-through field testing. We'll have another one on Thursday in Victorville. That was very successful. We plan to have more and more of those to help identify those who have the virus. We also have started a county dashboard last week that will give day-to-day updates of the number tested, the number identified with the virus, and those recovered, and those type of data coming out. It's important to know that San Bernardino is not just our own county taking care of ourselves, but we also are the backbone for many of the counties throughout California and the West Coast as far as the logistics hub. So we have many people going to work, doing their job to help keep the groceries in the grocery store, the pharmacies full of their pharmaceuticals, and so on. And but our residents need to do their part. Our residents who don't need to go to work, stay at home and be safe. Stay safe, stay at home. They need to keep up their hygiene, they need to keep their social distancing, they need to do their part so we can stay ahead of this virus and clamp it down. We have a lot of people working on it from every level that we can to get in front of this in our county, but it's important that we all work together for that. So for my residents, please do the right thing, stay at home, pay attention to orders. We're posting that information on our websites, constantly changing as they come down, and to keep your neighbors safe and to continue to see those acts of kindness that we see throughout our neighborhoods of neighbors helping neighbors within their social distancing, and take care of those, the vulnerable population. Thank you for being here.
Thank you, Mr. Chairman. Our next speaker is San Bernardino County Department of Public Health Director, Trudy Raimundo.
Can you hear me? Good afternoon, everybody. Thank you for being here. I first want to thank everyone for being here and extend our hearts and our condolences for the families that have lost loved ones as a result of this outbreak. I also understand that there is a lot of confusion and a lot of frustration going on right now in the community. So I wanted to take a few moments today to talk about kind of the details and some of the timelines as we saw this outbreak roll out when it began on Thursday, March 26th. So on Thursday, March 26th, we were contacted by Redlands Community Hospital to run a test for a patient that they knew was coming from Cedar Mountain. They actually asked us to run the test because they knew that we could expedite results, and they understood the urgency of the matter. Later on that day, we were ultimately notified by the infection control residents over at Redlands Community Hospital that the test did come back positive. We immediately notified Cedar Mountain of the positive results and provided them guidance, which did include closing of their facility to any further admissions or discharges. Unfortunately, as you saw in our press release from later on that day, the patient did pass away. On this same day, as per CDPH guidance, the California Department of Public Health, we called the state COVID hotline to let them know that we did have our first death in a nursing facility. Between Thursday and Friday throughout the day, Redlands community then collected specimens from 3 other individuals of Cedar Mountain, and again asked us to run those tests in order to expedite results. We were able to confirm on Friday that those 3 additional individuals were confirmed as positive. Saturday, understanding the urgency of the nature, staff from public health personally collected and delivered test kits to Cedar Mountain to ensure that all of the remaining residents, as well as the staff, could get tested. On that day, we were also made aware of a potential link to a second facility in Mentone. So we personally delivered test kits to that Mentone facility as well. Unfortunately, on Monday, we were notified of a second death from one of the confirmed positive patients at Cedar Mountain. To date, I was able to speak with my staff, and as of noon, we've now confirmed 51 residents of Cedar Mountain have been confirmed positive. 6 staff have also been confirmed positive. I do want to point out that there are still some specimens remaining to be processed and results are still pending, but we have talked to the folks at Cedar Mountain and we have let them know to assume at this point that everyone is positive and to take appropriate measures. Thankfully, we do not have any confirmed positives at this time from the second facility. Today, in an effort to start to mitigate this issue, we had an infection preventionist come down from the California Department of Public Health. She met with my staff this morning to talk about the issue. She then visited the facility to provide them guidance and consultation around what we call, or what you hear as PPE, so personal protective equipment, provide them consultation and guidance around appropriate isolation measures, as well as any other infection control measures that they should be putting into place. Ultimately, it is the responsibility of the facility to notify the state regulatory agency when an outbreak occurs. And with that, thank you.
Yucaipa Mayor David Avila.
Good afternoon. I'm David Avila, Mayor of the City of Yucaipa. First of all, I'd like to express our gratefulness and appreciation for the help from our cooperators, including city, fire, police, county government, county health, state, and federal resources. We recognize that Yucaipa, by its demographics, is at an at-risk population. Yucaipa, if you didn't know, has a significant, largely significant retirement community. We have several post-acute care, convalescent facilities, and senior mobile home parks. We will continue to work closely with the county public health and other state and federal agencies to assure that our people are protected as best as possible. We're monitoring CDC's information and the COVID-19, and it's updating our recommendations daily. And you can find that information on our website or through the county health website. We have activated our Emergency Operations Center in response to the COVID-19, and we will take appropriate measures as the need arises. The fire department will continue to operate as normal, although all casual visitations to the fire station has been restricted. They have in place the appropriate PPEs, which is personal protective equipment devices, to respond to all emergencies to manage the risk of its employees and public. Decontamination measures are in place, which include decontamination for their personal equipment, such as boots, medical equipment, fire engines, and fire department facilities, so as to not cause cross-contamination with the public or themselves. To ensure continuity in the fire department staffing and emergency response, the Yucaipa Fire Department staff are participating in screening for the COVID-19 symptoms. All non-essential activities have been canceled, including station visits, public relations, and education events. For our Sheriff's Department and local police, it is business as normal. Due to the design of the facility, the Sheriff's Office can receive customers on a drop-in basis and during normal business hours. They are equipped with personal protection equipment in the event of a need, and they are willing and able to respond to all emergencies as normal, as the Sheriff's Department has proudly served Yucaipa in all these years. In careful review of our cooperators, the City of Yucaipa has identified the following critical needs. We have made requests to the state and federal medical assistance to support local medical needs. We need these requests to be viewed and answered quickly. Local healthcare providers need appropriate personal protection equipment, including N95 masks, isolation gowns. Testing is a key to control and prevention. We need testing kits and the ability to get the test kits processed in a timely manner. Finally, we need our Yucaipa citizens and businesses to strictly adhere to the closures, and our citizens to exercise the tremendous power that you and I have in stopping the spread by staying safer at home. Thank you.
Next, we have San Bernardino County Sheriff John McMahon.
Good afternoon. Now, it's more important than ever to limit your exposure to the coronavirus by following the CDC guidelines. Social distancing is one of the best ways to prevent the spread. We ask that those non-essential businesses remain closed, and we ask that those that don't need to travel stay home. There are government code sections and health and safety code sections that can be used to enforce this, but our goal since the start is to get voluntary compliance, and it seems to be working. We ask that everyone take care of themselves and others. Do everything you possibly can to help us keep everybody safe and take care of those in our communities. And remember that we're all safer at home.
Supervisor Don Rao.
Today's sad news is a stark reminder that this virus is everywhere in all of our communities. On behalf of the 3rd District, Board of Supervisors, and my colleagues and the rest of the board, we want you to know that we take this very seriously. And the message that I would like to convey is that if this is not in your community today, that's a mistake to think that. It is everywhere. The numbers may not project that at the moment, but it is there, and you have to act as if you are potentially coming in contact with it. So the message of stay safe and stay at home is really instrumental to pass out to your family and friends at this time. I'd like you to know that I've been in close contact since this outbreak here in Yucaipa with Mayor Avila, our city manager, Ray Casey, and the rest of the council. We have open lines of communication and access with our County Department of Public Health, myself as a supervisor, and the rest of the county departments that they need access to. I'd also like to reassure you that San Bernardino County Office of Emergency Services has contingencies in place in the event that this outbreak continues to spread throughout Yucaipa and the neighboring communities. I encourage all residents in this county that have questions or need assistance to reach out to our COVID hotline, and I'm going to say the number. It is 909-387-3911. County of San Bernardino has a tremendous website and dashboard with lots of information to help keep our residents and businesses safe. Thank you. Stay home and stay safe.
Thank you, Supervisor Rao. Our final speaker for questions is United States Congressman Paul Cook.
Thank you very much. You know, it's kind of strange. I've represented this area 8 years now in Congress and 6 years in the State Assembly. And you get to know the people, you get to know the district. And unfortunately, the last 3 weeks, 4 weeks, all we've been talking about is this horrible, horrible virus that's going around. And my worst dreams were about the perfect storm, where you have an area which is densely populated, which is adjacent to the major transportation centers of California, if not the whole country, adjacent to 2 other very populous counties, obviously Riverside and Los Angeles. And perhaps because of my age, I'm not going to lie to you, I'm 77 years old. And the people that are most threatened are people in my age group. And the fear would, God Almighty, I hope that it never breaks out in a convalescent home. And this is what has happened. And that's why I'm here. Obviously, everybody has turned to. I think everybody knows how serious this is. And it could be serious today and even worse tomorrow if we don't do our jobs. Now, a lot of this is we've got to make sure that this does not spread. And I ask the people that are being interviewed, be honest. I mean, if you have come in contact with somebody that has worked in one of these facilities, has been a patient, let them know. Because one person could very well go out and give it to 50 other people. And we're not talking about 21-year-old kids here. We're talking about people with conditions which are seriously debilitated. So I'm here to learn. I want to know the numbers, everything else. I've already talked to Kevin McCarthy. He's the minority leader. I've talked to Pete Aguilar. We had a conversation yesterday. He's involved in this because he represents Redlands. And it's the same ask. It's not Republican or Democrat or Independent. We have got to step up the plate, make sure we do not let this become even more of a more dangerous pandemic. So I told them, I said, the ask, if we find out the data, will probably be for a strike team, for some of those things that the mayor was asking for. And obviously everybody in the country is asking for the same things. But the conditions here are all that perfect alignment for a bad scenario. And that's one of the things that I'm going to try and emphasize to the White House and to McCarthy. Now, I'm not going to speak for Pete. He's a great guy. He's a Democrat. I'm a Republican. But he is going to talk to Nancy Pelosi, who's the speaker for the same ask. This is a California. This could go viral. No pun intended, but the medical term, the serious consequences if we don't address this could be catastrophic. And this community would take years, if not decades, if not centuries in the history books to recover. So these are going to be tough times. Please, you heard all the guidelines. This is very, very serious business. And if you see somebody that's laughing about him, tell them, hey, you got people whose lives are at risk. And that's why I'm here. I took an oath a long time ago, in 1966, as a lieutenant in the Marine Corps. And so I'm going to do everything I can. And I need as much information, and I'll fight for you in Washington. Thank you for having me here.
Thank you, Congressman. We now have time for some questions in addition to our speakers. We also have representatives here from CAL FIRE serving the city of Yucaipa, from the county's Unified Command. And anyways, if anyone has any questions, yes.
To give us a sense, how many residents were living in that nursing facility, and how many staff members to compare with the numbers?
How many residents and staff members in the nursing facility? Does anyone address that question? Trudy?
It is a 90-plus bed facility. I don't have the number of staff though that were working there.
So were all the beds full at the time? 90 residents?
My understanding is we collected about 79 specimens. There were some staff that we were unable to test at the time, but we did let them know that everybody just needs to assume that they are positive
So
at this
79
point.
residents and staff members total. Specimens
We
that were
collected 79. I don't know the breakup.
I have a question for public health too. You told us about last Friday and this Thursday scheduled testing. What's it look like going forward from there as far as increased testing, more applications, more times?
So last Friday was actually an incredibly successful event. As you heard, our next event is going to be in Victorville this Thursday. We are hoping to do countywide, quite honestly. So we're looking at the Morongo Basin, ultimately the mountains, the West End. We're also looking at areas where we have what are called pods, points of dispensing systems. Typically they're used to dispense vaccines, but they're a great mechanism to be able to actually do testing as well. So we're going to work throughout the county and also use pods where we've got them set up.
When these testing locations have gone, how many tests are you doing at each one? What's it
In
look like?
San Bernardino, we did about 120, which was pretty good considering the fact that we did not actively advertise it. We did that intentionally to kind of test the waters a little bit and be able to learn from the process. We are going to do a full after-action report as a result, but I think we've got a great setup to be able to scale it out for the rest of the county.
Okay, before the next question, I'm going to make an attempt to repeat the questions into the microphone that you guys are asking, so the people who are watching remotely can make that out as well. We have a lot of people who are practicing social distancing not being here today. You need to know what we're hearing. Okay, is there a next question? Yes.
What's the demographics of the second patient that died at the nursing home?
Do we have any information on the patient who we lost yesterday? Age and gender?
I don't have those specific details in front of me. I'm sorry.
Okay.
Sir, do we believe some of the staff may have worked not only at that nursing home, but some of the other ones in the county?
Okay, do we believe that the staff at the nursing home in Yucaipa worked at other nursing homes in the county?
That was why we suspected an associated facility, because we were under the impression that there may have been staff working at both, and hence why we wanted to test the second facility. When we had a conversation with Cedar Mountain, they indicated that there was not staff going back and forth, but we still want to continue to monitor the situation and certainly monitor what's going on in the second facility.
Okay, yes.
Is the county going to transfer non-COVID hospital patients to open assisted living beds like other countries are?
I'm sorry, could you repeat that a little bit louder?
Is the county going to transfer non-COVID hospital patients to assisted living beds like other countries are?
Or is the county going to transfer non-COVID patients to other assisted living facilities?
Yeah, from the hospital to clear up hospital beds?
Right, to free up hospital beds, transfer COVID patients out of hospitals into assisted living facilities to free up hospital beds.
For confirmed non-positive or confirmed negative patients?
For non-COVID patients?
Yes.
Non-COVID patients.
Yeah.
Dr. Branch, internal medicine in the city of Yucaipa. The dashboard that has been initiated is wonderful. I would perhaps offer a suggestion that there be a link directly for providers on that dashboard when you are going to have these, that we can put in patients that we have already vetted as being appropriate for testing so that they can be moved up on the schedule for your drive-throughs.
We'll take that into consideration.
Sir, we spoke to some family members who had family members that were staying at that nursing facility. I guess they had been dispatched before you guys identified the outbreak. Have you been able to identify those people to kind of let them know that they may be positive.
So family members who were visiting the facility?
Yeah, visiting or people who had come through those doors.
Okay,
or
in other
dispatched
words,
before.
I think that probably speaks to our patient tracing investigations. I guess we're saying people who had visited these patients and then left the facilities, are we making an effort to contact them and
So these facilities, as a result of the governor's executive order and some subsequent orders, have actually been closed to visitors for some time.
Thank you. Another question? Yes, sir.
How many beds in the Mentone facility?
How many beds in the Mentone facility?
I don't know that off the top of my head.
It's approximately 59.
Approximately 59.
Approximately
Thank you.
59. Are there any other questions? All right, not seeing anything. I guess that will conclude unless any of our speakers have anything to add. Thank you everyone for being here. Thank you for everyone watching on Facebook Live and other platforms. And we'll be available for questions later. Thank you.